one morning, my son woke up and he had come to me on a Saturday morning. He said, I had a terrible dream. I dreamed you had cancer, Mom. And I said, well, honey, your mama don't have cancer. And if she did, she'd kick his butt. Because I didn't want him to be afraid, but I'd already known in my spirit that it was possible.
I started having numerous migraine headaches and hadn't had any in 4 or 5 years, and that put a flag up.
He got some more bumps in his armpit, just above where the initial one was, above his elbow. So at that point, we did a second biopsy, extraction and biopsy, and yes, it was absolutely confirmed that it was that type of cancer, and that's when everything just kind of started spinning really, really fast for us.
It was really scary, being a mother of 4 children, and you're now faced with this situation, and you're like, ooh, how is this going to end?
Emotions started to rush because we weren't ready. We weren't ready for that. So, sorry.
The radiation came into play after chemo. We had been told that that was a high likelihood that we would have to do it.
Almost all type of cancer patients, in some stage of their disease course, the radiation treatment are going to play a certain role.
Typically, most of the patients that I see have been seen by a surgical oncologist or a surgeon. Then the patients either come straight to a radiation oncologist for recommendations for any additional treatment, or through a medical oncologist who subsequently refers the patient to us.
First, I underwent a gamma knife procedure to get rid of the one in the brain. Then he recommended me to an oncologist to check the lung and did a series of radiation, and it got rid of the one in the lung.
My granny insisted that I came to UAMS. She insisted that I come back home because she says, honey, she said, in all my years, I know from experience that if no one can find out what's wrong with you, UAMS can. I went through 33 treatments of radiation to the neck, the larynx. So, yeah. It felt like it was the end of life for me.
Shalonda was a fighter. She experienced some significant side effects from radiation therapy, where she lost the ability to swallow and get adequate nutrition. She was admitted to the hospital and had to get a feeding tube placed, which got her through the remaining treatments.
Dr. Payne was great in just explaining exactly how this would work and dealing with Jack as a patient, not just, our child. And he was comforting to us too, and as parents, you really need that.
The Radiation Oncology Center is essentially the only radiation facility in the state treating pediatric patients. And we have been doing this at this facility since 2001.
The kids or pediatric patients are the toughest part about our job. I mean, I think everybody, all the therapists would agree that it's harder to, treat a pediatric patient than it is to treat a, somebody your age or older. You never think that it's fair that a baby has cancer. I've treated a baby that was 35 days old.
One of the main considerations that people need to know is that pediatric patients are not mini adults. The way that they are approached with radiation therapy is different than an adult patient.
It was scary because I didn't know what was going on, and I thought they were gonna do something, they were gonna do something to my body that would help it, but I didn't know how they would do that.
And everybody walked us through every step of what was going to happen. They were very transparent. Any questions we had, they let us know, and they were great with Jack. Here Jack is 6 years old going through this, but they talked to him and not just talking to Sarah and I.
We are able to establish a usually pretty good relationship because they have questions and we hope we have the answers. And if we don't, we find the answers.
I think that UAMS is set apart from other centers in the state because it's the only research facility for cancer. I think that's very important because it offers new ideas on how to approach a specific cancer, be it for adults or for pediatric patients.
Clinical research, clinical trial that is going to be available on this campus, and this is a very important. And for patients to have this opportunity, specifically for the tumor we cannot cure, and they have a chance to expose to new and ongoing research clinical trials.
If I hadn't have came to UAMS for all of this treatment, I probably wouldn't be here today. That was the way that I looked at it and the way I still look at it today.
And when Jack finished up his radiation, they had a nice poster board with a big congratulations signed by the staff and the doctors, and yeah, we still have it. So everybody was great. I'll never be able to thank everybody enough for how they treated our son.
I'll say that spiritually, physically, psychologically, in every area, it's different for me. I use two words a lot: amazing and exciting. Because now you've seen what it's like to possibly not be able to go forward and not be able to do normal things. This is your one opportunity to be exactly who you are. Whoever God formed you to be, this is your one opportunity to actually be that person. And whatever difference you can make, you want to do it.